Kia ora, I'm Dr. Helen Fulcher and I'm now talking to Dr. Dana Purvis, who's a paediatric dermatologist. Hi Dana.
Hi.
We're going to talk about eczema.
That's right. Well, I've been talking about eczema today, and eczema is a subject that's quite close to my heart. I mean, every specialty has its bread and butter.
Yes.
And I guess eczema is the bread and butter of paediatric dermatology. Yeah. And I'm particularly passionate about it because it's very common. It affects a lot of New Zealand kids. As many as 1 in 6 Pacific Island kids are waking up more than twice a week because of eczema. Yeah. So it's not well controlled in our communities. Yeah. And it is something that you can make better. Yeah. And there's nothing better than being a doctor who fixes people. I love it. And so I want to change your eczema patients from your heart sink patients to the ones that you feel excited about because you're going to be able to help them.
Fantastic.
So I've been working for a few years with the Paediatric Society. They have a national clinical network for eczema, and we've created a whole lot of resources to help people in primary care with eczema delivery. Wonderful. And we have resources for guidelines on how to manage your patients. There's some educational resources, including videos that were done as part of pharmac seminars. And there's some really good stuff in there for some nurses who work in primary care, talking about how you can develop a nurse-led service within a primary care practice, which is a really good way of delivering eczema education. And there's also some handouts that GPs can use because you know, writing stuff down is really helpful for people with complex management plans. Yeah.
Sounds fantastic. And so where do we go as primary caregivers to find those resources?
So they're all hosted as part of on the Starship website. So it's starship.org.nz/eczema network, and then you'll find it all hosted within there, and GPs can print off bits and pieces that they want. Some of the information we're also trying to embed into some of our health pathways as well. Yeah.
So it's readily available for everyone. In your talks today, you're going to cover some of the basic key messages of eczema care? Yeah,
I mean, basics of eczema is always all about moisturiser and topical steroids, so yeah, we talk about that. But I also spent some time talking about the non-topical treatment of eczema because there's been some new things that people can implement quite easily into their practice, and I know GPs often have very short appointment times and they feel quite pressured, so I've tried to be very succinct, the things that they can actually use day to day. So there's some really interesting stuff looking at preventing eczema in infancy.
Right.
So we know that using emollients from the first few weeks of life, using them regularly on a daily basis, can reduce the risk of eczema in a high-risk baby by as much as 30 to 50%.
Wow, fantastic.
So it doesn't seem to matter which emollient you use. They've used a range of them in the study, so just a simple prescription emollient would be a good thing for people to start with. And there's some information that probiotics used when pregnant as well as postnatally can help prevent eczema too. So that's something simple that GPs can recommend for their families.
Are they specific probiotics or are they, is there a wide range?
Yeah, they've mainly looked at lactobacillus. So that would be the ones I'd be looking at recommending. Yeah.
Brilliant.
And then beyond the cream treatment, which is still the absolute fundamental of eczema, you have to do your creams. They don't work in the tubes. But there are other things that people can do. So there was a recent Cochrane review that showed that antihistamines do nothing, so don't bother prescribing them. But we've just done some research at Starship looking at children with very severe eczema using methotrexate. So you'll be familiar with methotrexate for using it for rheumatological diseases, but very low dose methotrexate for eczema can be really effective at treating children with the very most severe disease. So the kids who've been repeatedly hospitalised or recurrent infections, not responding to topical treatments. And we've found that about 80% of them improve when they're on methotrexate. And what's been really exciting for me is that we've done a follow-up looking at what happened to them when they finished the methotrexate. And so we looked at the kids about more than 2 years after they'd stopped the treatment, and 2 years out, 2/3 of them were still mild or clear.
Wow.
So it seems to give some long-lasting benefits for those kids in that really severe group. So methotrexate, there's other agents like phototherapy that can also be helpful, but I think it's really important if you've got a family that are struggling with really severe eczema that you don't give up hope, don't tell them there's nothing else that can be done, because there is more that can be done for them.
And what do you suggest for those primary caregivers throughout the country? What do they do next? So if we do have a child that you're not winning with, what's the next step?
Well, I mean, I think it's worth, as I said, look at the website. There's got some really good, make sure you've got everything's I's dotted, T's crossed for management. I think it's really helpful to get some formal measures of severity, particularly if you're referring a patient, because that can aid the person triaging your referral at secondary care level. And so there's a eczema severity measure called the POEM score, Patient-Oriented Eczema Measure, and we're going to be linking to that on our website, but at the moment you can find it on the University of Nottingham website, POEM, and we'll put that on there. But this is a symptom-based severity score that the patient or the parents complete. Takes a minute or so to do, and so I can get people to do that while I'm writing their prescription and writing their action plan. And if you're finding that patients are persistently getting severe scores on that measure, then it does tell you that they've got severe disease, and something beyond what you can do with topicals and primary care is necessary for them.
So first check that you're doing the maximum that you can in primary care, try and get some severity scoring going, and then
look to refer. And certainly at Starship, obviously we see a lot of patients at a secondary care level from the Auckland region, but we do also see tertiary patients from around the country, and I do shared care with a lot of general paediatricians around the country. So I've got children on methotrexate in Invercargill and Hawke's Bay and all sorts of places that we do a shared care model to manage those children with the most severe disease. So there is something out there for these people.
There's support for both the practitioner and for the families. Wonderful. Thank you, Dinah.
That's right.
We'll enjoy hearing your talk today.
Okay, thank you.